Hi everyone, Dr. Siddiqui here. Today I'm joined by Dr. Khader. Welcome.
Hey, how's everyone doing?
Well, we're very excited to have you today with us. So before we get started, can you share an interesting story with us?
Sure. So my name is Waseem Khader. I grew up in West Virginia and moved out to California, I want to say about 4 years ago, to pursue my dream in medicine. Started early in the process, and I knew I wanted to be out here in California. So interesting story. I'm not sure interesting story as much as interesting fact, I guess. I'm a yogi. I love meditation, and I love kind of finding oneness in my environment around me. I think it's an integral part of my medicine and the way I treat my patients. So like 2 weeks ago, I was out paddleboarding for the very first time, did yoga on paddleboard headstand, which was phenomenal. So yeah, there's just another random fact for you guys.
That's wonderful. All right, so let's get started. Tell us a little bit more about yourself. So you said you moved to California recently. So give us a little bit of background. Who are you? What do you do? And where are you in your training?
So, like I said, I grew up in West Virginia. I'm a family of immigrants. My parents are from the Middle East, grew up there, and first generation came here when they settled in West Virginia. I come from an educated family. My dad's a professor, doctorate, but no one in medicine. I feel like that was a challenge for myself. For me and my brother, both of us in our family went into medicine. So I think something cool for me was I had my brother alongside me in medical school, 2 years younger, but he ended up finishing before me, which is also an interesting fact. But I think for me, my typical immigrant family wants success in their children, and something my dad always taught me is education is superior to anything else in this life. You want to make sure if you're well educated, you make your connections, find your way, you end up doing well in this life. So that's something, a value he instilled in me. And another one was health. You can never spend too much on education or health. So I carried that to heart, and I think part of my, a lot of immigrant families I know, they want their kids to be very successful. And a lot of us, typical Arab families, my background, they want us in either medicine or engineering or law or something that can provide you good connections in this world. So I wonder, and I think my story, like very many, a lot of us are kind of placed on this path in medicine, but we have to make that consistent choice along the way to really endure the process, because it's a very long road, and it changed me. I know it changed a lot of us in this path. I think a lot of us enter medicine wanting to do something and have this like unlimited potential in what we want to do. And then we start getting groomed along the way. We meet certain people, we get into certain programs, and we make our connections. And slowly, I think we start to find our path. I'm a wanderer in this world. So although I am along the path of medicine, I still feel like there's so much more for me to explore. So I ended up in family medicine. I'm out in California studying. I'm in my second year of residency. And I just recently started my moonlighting, and I started working in urgent care. So it's definitely not where I thought I was going to be at this point in my life, but it's definitely it's very fulfilling. There's a lot in it, but it's been a very enlightening experience, and I think it will continue to be.
Beautiful. So let's talk about I know you talked about moonlighting, so let's talk about what that entails. When can you start moonlighting, and how has your experience been like?
Yeah, so the rules in medicine are always changing, but and I think it's going to change in this upcoming year. Residents won't be able to moonlight until they're actually done with their residency training, because that's at that point that you can actually apply for some portions of your medical licensure and DEA. But I'm part of that crowd that just before the new rules came into place. So for me, I started moonlighting after my into my second year of training. So, and for many of us in medicine, loans are very heavy on us, because we sacrifice a lot when we go through medical school. A lot of us don't come from very, I guess, wealthy means, and so we have to kind of build our way slowly. And me being very kind of financially savvy in my own life and wanting to really budget everything I do, something that would weighed on me for a long time is my loans. And so part of the experience of moonlighting is to try to make that extra bit of cash, because God knows as residents we don't make too much. We work a lot harder than what we actually make. And so for me, it was a chance to make a little extra cash, but also trying to explore different areas, trying to know what I want. Because family medicine is the beauty about family medicine is it's so broad a field. People specialize in different things. You can be a hospitalist. You can go into outpatient. You can do urgent care. The reason I like urgent care is quick stop and go. You have someone who can't get in with their PCP. They want something quick. They come to you. You kind of evaluate them. You make sure to set them up to get back to their PCP, but you take care of them in the now. It's in our society, in our millennials at least, we want everything now. So
gratification.
Exactly. So that's where, as doctors, you have to really endure delayed gratification. But this is a little bit of instant gratification that I can share with my patients and myself that makes, I think, this moonlighting experience really cool.
Very cool. Interesting. All right. So let's talk about the biggest challenge or struggle that you've had going into the medical field.
Yeah. The biggest challenge, I'm going to say I have a lot of challenges. Medicine it hasn't been an easy road for me. I don't think it's an easy road for a lot of people. I think a lot of it is outlook to how you view the world and how you view your challenges. There's that old saying, what doesn't kill you makes you stronger. And I think that is very true in medicine. My biggest challenge, and one of the things that really drove me in medicine, was my mother. So my family was plagued with disease at a young age. My mother, when I was in high school, she got diagnosed with stage 2 breast cancer, and hence the ribbon that I always wear, and the causes of breast cancer that I help support around me. I did a lot of Relay for Life events through college and medical school, and even in residency. Finding time to volunteer, giving back to the community, that kind of keeps your soul rich, and I think that's something that can't always get lost in our work. We got to remember to get involved in our society around us. So that's part of the challenge I personally had. I had to struggle through a lot of emotional turmoil. I think when you have a dying mother through the process, it's a constant reminder you see your patients, and it develops a certain kind of empathy that I can really connect with my patients sometimes. But it also can be a little overwhelming. A lot of what we deal with in medicine is death too. So just a week ago, a 31-year-old male, just younger than me, dead. And I was actively involved in his care, and it sucks. It really does. And we have to be able to handle that very well and keep our composure, keep not just at work, but even in our personal life. So I think one of my most recent challenges has been really balancing my personal life with medicine. For the longest time, I was just a student going through medical school, looking to my future, knowing what I needed to build, and that's all I focused on. And I think my personal life was kind of put on the back burner. And that's something we talk about wellness in a lot of the accrediting bodies in medicine. They talk about resident wellness, and we hear the phrase physician burnout. We hear all these things. So these are the struggles of our generation in medicine. We have undergone a huge shift in medical care, and reimbursement, and how many hours we're putting in, and documentation, and web-based documentation. So all these shifts are taking more and more of our personal time away from us. And I think we need to, one challenge I'm finding as a resident is being able to balance that home life with my work life. And slowly and steadily, I'm doing well. And I think all of us are doing what we need to do. But yeah, I think that's like a daily challenge. I think not just I go through, but a lot of us go through, you know?
So you answered my question that I was about to ask you was how do you go about balancing that whole work-life balance? I mean, you're a resident, you're working a lot. What are some of the things you do that that helps you stay sane? Having to deal with death, having to deal with like long hours. What are you did brush up on a few things that you do that helps you de-stress, but give us some tip and advice on how you've been handling that.
So I'm gonna kind of backtrack a little bit with this question too, because part of the reason I chose California, in my fourth year of medical school, I knew I didn't want to be in West Virginia anymore. I love West Virginia; it's my home, but I knew I wanted something else, and that came into play with my work-home balance more so than anything else. I knew I wanted sunny weather, which is California, Southern California. I knew I wanted diversity, everything, everyone. Like there's so many cultures, so many religions, so many people. It's amazing in such a small, well, I guess not so small a region, but also there's the whole idea of like being at the beach. Like there are weekends where I am just burnt out. I've had a hard week. I had a few deaths. I'm working, so many hours, and I'm just tired. And I just like to drive over to the beach, go down the Pacific coast, and just listen to the waves. That's one way I've learned to de-stress. Another thing is I learned something, and I actually want to make a plug here for a really good app I think that a lot of us can use, called Headspace. Those of us in medicine who are members of the AMA, we actually get 2 years free membership just for this app. But it's changed my life. It's called Headspace, HEADSPACE. And it's a simple meditation app. That's one thing that's changed my life. My yoga I've had since, and that's another story maybe we can talk about later. But yoga's been a part of my life for a long time, and it's been the practice of meditation has been a new development in my life, at least a new level of awareness I've developed for it, and how it's been able to benefit not just me but my patients. Because one thing we can't neglect is our own wellness. Because unless you are well, it's very hard to treat your patients. You need to be in a good state to be able to open up to them and to be able to share the lessons that could really benefit them from their day-to-day life. So for me, the other aspect of de-stressing and being able to balance my home and work is doing a minimum of 10 minutes of meditation a day, and part of the app helps me do that every day. It sends me daily text reminders to meditate, or notifications to meditate. So that's another way I do it. But also having time for your family. I knew the hardest times for me were especially intern year. I think that's one of our biggest struggles in medicine is when we hit our first year of residency, because we move on from that role of, I guess, active or passive learner to active involvement in patient care. And we're seeing, when I started my residency process, I was seeing on average 15 to 17 patients a day that I was caring in the hospital. So that was a struggle, and you're learning how to treat patients. You're working through mistakes. You're working through, you're responsible for your patients. And when you do something great, you feel good. When you don't do something that great, you're learning, but it feels horrible, and because that your actions can affect multiple amounts of people. And that's something I think as physicians, we have to be very conscious of all the time. We have to be very aware of how we're affecting our patients. We need to be able to follow up with them. So, that can add another level of stress. So, and more recently, I found the love of my life, and I got engaged to her, and she's made my life so much more peaceful, So having time peaceful at times, but at times, it's a relationship, so there's a struggle there too. And, for me, the fortunate part is she's also in medicine. So her time is also very valuable, and her time is also very limited. But it also allows me to connect with someone who can understand my struggles as well. So,
Mm-hmm.
I think that's the balance, like learning to get out of work on time, not having your notes, because again, documentation, we're spending almost 70% of our day documenting our encounters, taken away from our patient care, but that is the nature of medicine nowadays. So all new medical students going through the process, you got to learn to love to document. Otherwise, it's going to be a struggle. So develop habits, develop a system, and it takes time, and it's gonna be frustrating. I got so frustrated so many aspects of especially my intern year, but it's that frustration that keeps you going sometimes. Just
Mm-hmm.
don't let it overwhelm you. Learn to keep your emotions in balance. Learn to balance your cognitive mind with your primitive mind, and learn to navigate the system. Learn to communicate with people. There's a lot to it.